Ryan Reynolds here from Mint Mobile. With the price of just about everything going up during inflation, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, how to get 30, how to get 20, 20, 20, how to get 20, 20, how to get 15, 15, 15, 15, just $15 a month? Sold!
Give it a try at mintmobile.com/switch.
$45 up front for 3 months plus taxes and fees. Promo rate for new customers for limited time. Unlimited more than 40 gigabytes per month. Slows full terms at mintmobile.com.
How do you feel great on vacation? Like really good? Easy. You go to Aruba. You'll spend your time relaxing on cool white sand beaches and floating in healing blue water. You'll immerse yourself in natural wonder and find your center on an island where things move at your speed. You won't just feel great, you'll feel relaxed, renewed, and ready for life. That's the Aruba effect. Plan your trip at aruba.com.
Last week, I was seeing a 15-year-old girl for her well child visit. I see her really often for other issues, and this was supposed to be her well visit, as in no problems to address, just checking her hearing and vision and her blood pressure, just regular stuff. But I always ask at my well visits if there is anything else, and that's when she said, "My back hurts." Okay, I said, "When did your back start hurting?" And she said, "About 3 years ago." So I just turned to her dad and he and I just stared at each other. Parenting is so different when your kids get older. I don't even know if I can explain. When your kids are little, you watch them walk and you worry that they won't grow out of their toe walking or their legs are always going to turn out in a funny way. We talked about these things in the last few episodes. But then you get to the teen years and you don't really look that closely at your kid anymore, and they certainly do not tell you what's going on with them. So, how do you deal with orthopedic issues as your kids get older? Things like asymmetries in their hips or ankle, or shoulder pain that isn't so bad that they can't play their sport anymore, but you don't quite know at what point to get things checked out. Dr. Jacob Schulz is a pediatric orthopedic surgeon and an associate professor at the Children's Hospital at Montefiore in Bronx, New York. He's going to tell us about how to address these asymmetries, aches, and pains in kids in their older years. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kids' health. I mix the science of medicine with the reality of parenting. I ordered an x-ray on my patient with the back pain, and it came back showing that she has something called spondylolysis. That's a fracture in a vertebrae, and it can happen from repetitive stress, but some kids are just born with it. So is it causing her pain? I have no idea. Does it matter for her sports participation? I'm not really sure anyone knows the answer to that. What I can say is that nobody should feel badly that we didn't find it until now, and it's practically impossible to know when you should reassure your kid about their pain and when you should see the doctor. The funny thing is that her brother has a chest deformity. His breastbone caves in. It's called pectus excavatum. His parents hadn't noticed this until I lifted up his shirt at his well visit, and that's a really common way to find this. We just don't look at our kids' bare skin as often when they get older. So it's not that surprising that his parents didn't know. When do you need to take care of these kinds of orthopedic issues like a pectus or scoliosis? Let's see if Dr. Jacob Schulz can help us sort this out. What is the most satisfying thing that you get to diagnose and treat?
It's a great question. I personally do a lot of scoliosis surgery, and I love helping out kids with scoliosis, which is a relatively common spine condition in children with crooked spines. Most of them are self-limiting, where they have scoliosis. They will have it forever. It won't go away, but it's pretty mild and should not be an issue. But there are kids who will benefit from treatments such as bracing, and this can be really effective to help prevent the curve from getting worse. But there are plenty of kids who even with good bracing and treatment, the curve gets bigger. And then if they get to a certain age and they're done growing and the curve is more than about 45, 50 degrees in their spine, those are the ones that will continue to get worse over time. And those are the ones that really do benefit from surgery. And so I find those very rewarding because you notice them. It is amazing how frequently they can be missed. When kids get into that adolescent age period, parents don't often look at them naked like they did when they were 2 or 3 or 5. And then one day they go to the pediatrician. All of a sudden, the pediatrician, notices this asymmetry. So getting to really explain to the family, meet them and learn about them and talk them through the process. And then when necessary, performing surgery for these kids, I think can be really life-changing. We think that most scoliosis that occurs in kids occurs in the adolescent phase as they go through that late growth spurt. And so we think starting around age 10 is when they really should be a concerted effort to examine them well at the yearly pediatric visit. This used to be something where everyone recommended a school screening with a nurse. It's pretty controversial. We don't universally recommend that, but I definitely think starting at age 10 is when we look forward. Although some kids, it develops even earlier. So I do recommend, parents should be looking at their children. The pediatrician should be checking out their kids. And it's always good to look at them with their shirts off to really see any subtle asymmetries in their shoulders and their chest and their waist.
Yeah. Are there other orthopedic conditions, asymmetries that you should look for during the growth phase?
We certainly can see asymmetries in any part of the body, and we treat as pediatric orthopedic surgeons, we treat everything from the spine to the arms and legs. But you commented on pectus, and I will say that chest wall deformities are remarkably common, especially in my practice. And that's true with or without scoliosis. So they can go together or they can be completely independent of one another. For a very wide range of asymmetries, they're all pretty normal and pretty benign, although they can be concerning to parents because of the appearance. So we think of pectus excavatum, where the chest kind of caves in the front, and pectus carinatum, where it points out. And the excavatum, parents think, it caves in, it must be pushing on their heart or their lungs or some vital structure. And except in extremely rare cases, it just, everything moves out of the way and they do fine. There are some surgical treatments for this, but the vast majority of kids, I think, don't need it. And there are some obviously risks associated with that. So almost always, especially painless variations in the chest wall are just that, variations. And, it's something to ask a question about, but rarely something to be really concerned about. Obviously, change is the operative word, right? That's what we deal with. We deal with growth and change of the bones. And so, that's apparent clinically, but it's more apparent radiographically on x-rays. The way a child's bone will look on an x-ray is very different than adults. And this comes into play a lot with trauma, where, the ER will see a kid get an x-ray of their elbow or their wrist, and they'll think there are fractures there, and those are just normal lines that we see on the x-ray, the growth plates. Or the centers of bone. So there are growth plates all over the human body when kids are young. And these are like factories that make new bone. And on an x-ray, they kind of look like a fracture. They're just a line. But what they really are specialized cartilage cells that are busy making new bone to get the bones longer. And some growth plates are really active and make a lot of new bone and really contribute a lot to growth. And some growth plates don't contribute so much to growth. And depending on where you have an injury around that growth plate, that can either be really beneficial because you're close to a growth plate that's very active and there's more potential for growth and remodeling, or it can be more concerning because you're injuring a growth plate that has a lot of potential for growth and remodeling, and that could be a problem. So that ability of the body to grow and change so much faster in a growing child is really what differentiates them from adults, from my perspective, and what makes our job both wonderful and but also challenging in certain ways that you can affect things either positively or negatively in a big way. And that's really important. The big example, the really common one that we always see is wrist fractures. And so the radius bone, the bone by the thumb side of your forearm, is a very common area to break your wrist. And when you break that bone by the wrist, where the growth plate is so active and powerful, especially in a kid who's young, less than 10, you can tolerate almost anything with there. And we're actually involved in a study looking at these fractures in kids all over the country to see whether they even really need treatment or surgery for these fractures, because there is so much potential. Whereas if you break the radius bone closer to the elbow, that is a very different situation because that growth plate is not quite as powerful in the same way. And those are much more likely to result in permanent deformity if not treated appropriately. So, we get, the same, it seems like the same fracture, even a less concerning fracture, that doesn't look as displaced, can be much more concerning to us, depending on where it is and how close it is to a certain growth plate.
Your point is, though, that it takes a real specialty to evaluate these things, because if your fracture or your broken bone, that's a synonym in medicine, is near your elbow in that long bone, that's very different than that just common buckle fracture that's near your wrist in the same bone. What about the concept of that being a ring of bone, the radius and the ulna, because they're connected? I always love to think about this. If you break one, you might break the other. Yes.
Yeah, very common. In adults, we almost always, if we break one, we break the other, or the adults, the bone will break. And if the ulnar bone doesn't break, then usually there's a dislocation or a real injury by the wrist joint. Whereas in kids, because there's more plasticity, I think of kids' bones kind of as fresh green twigs as opposed to old dry twigs like your bones or my bones. And so sometimes you're talking about those buccal fractures, instead of snapping, really breaking completely, they kind of pop on the sides. And that's that little buckle that you can see on an x-ray. So yes, because they're a ring, right, they work together, and we have to, we always have to respect that relationship between the two. Although once again, in kids, it's a little bit more forgiving than it is in adults.
Kids' bones can bend, so they break differently than adult bones, and kids have growth plates that are growing, so they heal better than adults. They also have deformities like scoliosis and pectus, so they can sometimes look kind of funny, but these things don't always have consequences. What about pain? Kids complain to us about pain, and it's hard to know when to tell them to go back to playing and when to take them to the doctor. Pain is just as interesting a sign in kids as their bone structure. How does Dr. Schulz approach pain?
So the first thing I'll say about this, and this comes into play about what I talk to parents about, is that pain, and this, is a completely subjective response. There is no test for pain, and everyone's pain is different. Everyone feels things differently. And you can stab the same person or stab people the same way and stab 100 different people, and they'll all feel it differently. Pain is an important sign that we see, but because it's so subjective, it's a little unreliable in a lot of ways. And so I think our job is not just say, oh, they have pain, but really to characterize the pain and see how does the pain affect them. It's much more concerning for me to see a kid who doesn't have quite as much pain, but the pain is affecting their ability to do things they want to do, than a kid who says they have 10 out of 10 pain, but they're going to karate class 3 times a week, like it's no problem. Those are very different situations, and I'm much more concerned about the kid who's kind of hiding his pain but not participating in activities. We used to think that if a child had any pain that was completely abnormal and that was a real sign of a very concerning problem, and back pain was the classic example of that. If a kid has back pain, it must be some horrible problem. However, this is really not the case. And the vast majority of pains that kids get are similar to the pains that we get, I think, in a lot of ways, right? They come and they go. And kids, especially young kids, are not always able to express their pain the same way and have the same vocabulary of pain and have the same frame of reference for what is quote unquote normal pain and what is not normal pain. And so, this may be the first time they're experiencing any pain. And so they may catastrophize it a little bit. Whereas, you may wake up on any given day and have some aches and pains and go, okay, this is going to go away. So I think it's important to keep that in mind when thinking about kids.
So hip and knee pain often can be really confusing in pediatrics because there are a couple of specific conditions that can happen only in kids, right? And it can be dull or achy pain. And you can have pain in your knee when really you have a problem in your hip. So how do you sort out?
Yeah, that's a real classic example. So whenever I talk with pediatricians and with my residents, I always say that if anyone has knee pain, you better examine their hip, because what you said is exactly true. The knee pain can often be referred pain because of the same nerves that go to the knee have to cross the hip joint on the way. There's a very specific problem in the hip that kids get usually in the early teenage years, but sometimes early, called a slipped capital femoral epiphysis, which is really a problem with the growth plate. And I said before how the growth plate is a factory that makes new bone, but it's also a glue. that connects two parts of the bone together, what we think of as the epiphysis, or the head of, in the femur's case, the head of the femur, and the metaphysis, or in this case, the neck of the femur bone. And so in some kids, for reasons we don't fully understand, the glue doesn't act as gluey as it should. And because of that, the two parts of the bone, the metaphysis and the epiphysis, or sometimes we call it the ice cream and the ice cream cone, can displace relative to one another. And then even though it's a hip problem, the kid may come in with knee pain, and that may happen 25-30% of the time, but they're really not complaining of their hip, they're complaining of their knee. And there are plenty of horror stories of people who've had MRIs of their knee, even surgery on their knee, but really the whole time it was their hip. So the way we distinguish that is we always examine the hip whenever there's knee pain. And your hips should be really symmetric when you examine them. They should rotate the same way. They should move the same way from side to side. And any variation in that examination should really warrant further investigation with an x-ray of the hips. If you miss one of those hip problems, that slip capital femoral epiphysis, or SCFE, as I was saying, they can go from kind of benign problems that are treated easily to really severe problems that can lead to long-term disability in the hip, arthritis and pain and difficulty walking. So that's really what we want to avoid. I don't want to get too alarmed, though. Most knee pain is pretty benign. Knee pain is very common. I'd say knee pain is far more common than hip pain in kids. So hip pain always gets my attention. Knee pain makes me think of the hip, but most knee pain is like a pretty benign problem.
I think this will come as a huge surprise to most parents, and honestly, maybe to some doctors, but bones themselves can get infected, and you can get osteomyelitis, which is horrific. But the cases I've seen generally are kind of subtle, which freaks me out.
Yes. Yeah. Infections are always the trickiest. They're hard to predict. They're hard to diagnose in the first place sometimes. And then they often can be a long course of treatment required. But yes, as you said, kids can develop osteomyelitis or infection in the bone without any trauma, any cut in the skin, any preceding illness. Sometimes they have a preceding trauma. We think that may be a predisposing factor, but plenty of kids get trauma all the time and don't get infections. Whenever we get a kid with an infection in their bones, the first question is, how did they get this? Where did it come from? Did we miss something? Did we do something? And almost always the answer is no. I mean, it's just an unfortunate, wrong place, wrong time kind of situation. And the bacteria makes a little home in your bone. And if it's caught early, it's treatable with just antibiotics, but often they need surgery.
This is so tricky because then you have a million other kids who come in with what we call growing pains because we have no idea what it is. Mm-hmm. But how do you differentiate growing pains from all these other horrible conditions?
Yeah, so true growing pains is a term that I think is used a lot when it's not really applicable. But the classic way that we think of growing pains is a kid, usually less than 10, sort of earlier, not usually the adolescents, but the younger kids who are growing a little more in that steady state of growth. It's almost always at nighttime that they get it. It's almost always the legs and both legs. So I'm much more concerned when a kid is just one leg or a very specific spot in a leg. But if it's both legs and sort of vague when they go to bed, and it wakes them up from sleep at night, it can be very concerning to the parents. But usually it gets better with a little bit of Tylenol or a little bit of massage. And then they wake up in the morning and they're running around like there's no problem. And so that story of every night or most nights, they wake me up and they're so, while that is concerning to parents, that's actually very reassuring to me because that is almost always classic growing pains. Whereas the kid who, in the daytime won't play, as I said before, is letting it interfere with their activities, that's much more concerning. And then localizing signs, so a single spot, changes in the skin, once again, are changes in activity. Those are what I look for.
I had a case last week of a 15-year-old who had back pain for 3 years and finally mentioned it to her parents. So I wasn't that concerned, but I did an x-ray on her back and she has spondylolysis, which I don't really even know what that is, but also I still can't sort out and I'm not sure her doctor can either. Is her back pain from it or is it not from it?
That's a great question. So the first thing I will say about back pain is that I mentioned before scoliosis. And scoliosis is a fairly common thing. We think about 2% of people get it. I think of scoliosis and back pain very separately. They can be related. I can't prove that they're not. But most people I see with back pain don't have scoliosis. And most people I see with scoliosis don't really have much back pain. Spondylolysis and listhesis, however, is clearly associated with back pain. But most people who have it generally are pretty well off and do not have that severe pain, and are very functional. There are studies that show people with spondylolysis, playing football and doing gymnastics and things like that at a pretty high level. So it's not necessarily a debilitating thing. But yes, it definitely can be the cause of kids' back pain. Usually it will improve with a period of rest and physical therapy, once again, our favorite treatment. But it can be a significant issue. And it can go from the very mild, just a little crack in the bone, although that can be even more painful almost than the severe versions where there's actually a slip, the one bone moves on another, or the spine translates on itself. And that can result in deformity and nerve problems, which can be much more concerning.
Do you ever find things on X-ray that you would consider an incidentaloma, so an incidental finding?
Yeah, we see a lot of these. So the classic example is what's called a non-ossifying fibroma, which is a benign, meaning not concerning, little cyst in the bone where instead of being normal appearing bone, it's fibrous tissue, and on the X-ray, it looks sort of like a little circle, a little hole in the bone. Often they're small. They almost never result in pain or increased risk of fracture unless they're very big. And they often can go away once kids are done growing. The most common way I find them is when I take an X-ray of a painful knee and I get an X-ray of both knees and it's in the other leg. So that's the one. And then I'll say, well, listen, you have this thing, but that's not your pain because that's even the wrong leg. And even if it is the right leg, it's not where the pain is. So almost always benign, but sometimes you do pick up more severe things, and every once in a while we see something really severe, like even rare bone cancers, which we can see, which thankfully are very, very rare in kids.
Of all the things that you've seen in your career, what are you going to try to do with your children to prepare them for not having injuries or avoiding seeing you ever?
The thing I say to families is you can't prevent all injuries, right? You have to let kids be kids, and you can't always be stressing about things that might happen. You have to let them live their life. What you can do is you can give them good tools to work with. So number one, exercise, right? It is unfortunately an epidemic of kids who don't get enough activity and exercise for various reasons. Sometimes some things you can control, some of those things you can't. But encouraging your children to be physically active and exercise on a regular basis. I don't care if kids play sports. I love sports, but it doesn't matter to me if you play sports. But I want you to be active and strong.
Straight from the mind of a pediatric orthopedic surgeon, after all he has seen in his career, he recommends playing with your kids. And maybe get them in a bathing suit so you can see the curve of their spine and the symmetry of their chest and shoulders. It sounds like he's recommending you take your family on a beach vacation. And who am I to argue? Thank you to Dr. Jacob Schulz for sharing his experience and advice. You can find him at Montefiore Children's Hospital in Bronx, New York. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.